But let's talk now about coronavirus. White House Press Secretary Kayleigh McEnany, who recently was actually diagnosed positive for coronavirus, has said that the president is, quote, ready to go. The president wants to hold rallies in Florida this weekend. And for a reminder, today is exactly 1 week since the president let us know that he tested positive for coronavirus. So to chat more on this, we're joined now by Yahoo medical contributor, Dr. Dara Kass, Columbia University Associate Professor of Emergency Medicine. So, Doctor, we're seeing that the president is itching to get out there and hold rallies in person. As I mentioned, literally just a week after he revealed he tested positive, less than a week since he went to the hospital, Walter Reed Hospital, for coronavirus treatment. Can he already be over this virus that quickly?
Not according to his own CDC. His CDC says that 10 days after diagnosis or symptom onset is the minimum amount of time you need to isolate as a positive coronavirus patient. Now, if he had symptoms before Friday, let's say that he started symptoms on Tuesday or Wednesday, he might actually have a case to be made for ending his quarantine. But that would also mean that he was symptomatic and spreading the virus without being tested. So right now he's in a bit of a pickle, I should say, in that the best positive test case we have is that he was positive on Friday morning at 1 a.m, in which case his quarantine should still be going on.
Okay, so if, let's just say he decides to hold this rally. I know that we have 6 feet. I don't know where the rally might be held, but I mean, first and foremost, how safe is it for someone who's currently recovering from coronavirus, even though he says he feels great, he feels better than he has 20 years ago, better than ever before, he says. How safe could it be for him in terms of his recovery? Could it derail his recovery? And let's just say he decides to go forward. People wear masks. It's outside. There's distancing. How safe or unsafe I should say, would it be for people that might attend?
It's unsafe. Let's just leave it there. It is completely unsafe and absurd that there should be a rally with a known infected patient who has coronavirus. We also remember that the president does not accept wearing masks all the time. So it means that when he arrives at the venue, when he's getting his microphone placed on, when he's walking around security, flying on Air Force One, all are opportunities for him to spread this infection to other people. His CDC clearly states that 10 days after positive test or symptom onset, you should stay in isolation, and that's what the president should do.
One last question about these rallies. Even if the president doesn't go, his son, Donald Trump Jr., is holding rallies. I was looking at a video, I believe it was yesterday evening or the day before, holding a rally. Everyone inside, it appeared, crowded, maskless. Do you view these rallies and these campaign events as potentially super spreader events?
Absolutely. Remembering that the only reason we know about the Rose Garden event is that there were people that were notable there. We have no idea how many people were infected at any of these other rallies, especially the ones indoors, because they're regular people like you and me. And nobody puts it on the news when they get coronavirus. They just go about their business, get admitted to the hospital, and some of them may even have passed away. So the fact that this campaign, this administration, is still holding indoor rallies that are maskless, behaving in a way that's irresponsible to this virus, says a lot about how they feel about the people that go to these rallies, their voters and their supporters.
So speaking about that, because we are seeing some of these super spreader events pop up all around the country. And in part with that, and in line with that, we are now starting to see cases surging in areas like here in the Northeast, where case counts had previously been declining, the positivity rate had been declining. A second wave had long been, as we've been talking to some folks, anticipated and expected. And we keep asking, is this it? Is this it? Is this it? So I'm going to ask you that question. What we are seeing now, is this it? Is this the second wave?
So I think for an area like New York City, which got its positive test rate way below 1% regularly, then yes, we are looking at our second wave right now. For areas of the country that never got below a positive test rate of 5%, or even the entire country, which is currently at a 40,000 to 50,000 positive test rate per day, we're saying this is still really a bump of our first wave that never ended, right? We're at the third hump on the camel, but we certainly aren't we never had a low enough case count to consider ourselves in a nadir. In New York, we did, but certainly not as a country.
One last question for you here, Doctor. Remdesivir published a study that shows that its drug and its recovery treatment actually cuts recovery time, by 5 days. So I know that you've been talking and you've been saying the CDC says that, recovery time is essentially 10 days. But can it be that one, if you're taking remdesivir, that the recovery time is actually now 5 days perhaps? And is it possible that the president, after taking that treatment from Regeneron, could have reduced his recovery time to just a week?
Okay, so we need to not confuse multiple case scenarios, and certainly don't need to overinterpret the data. The remdesivir data was for hospitalized patients and reduced their hospital stay from 15 days to 11 days. And so that's what they found. It did not reduce mortality. They think it may ultimately reduce mortality, but not in the number of patients that it studied. What the president got through his Regeneron cocktail was just antibodies. Now, these are excellent monoclonal antibody cocktail. It's two different antibodies. But what that did was it gave his body a fighting chance earlier than his own body would have made antibodies to begin. Now, my body made antibodies when I had coronavirus, and I don't consider myself cured of this virus because most viruses live in your system for a period of time. So the antibodies he got are definitely not a cure, and they should not change his infective period, at least not by any objective data we have yet.
I really appreciate that fact check, and just a reminder for everyone, because I'm no doctor or scientist at all. And I think a lot of us, when we see these headlines, there's a lot of misunderstanding that is going around in terms of these drugs and these treatment options. So thank you so much for clearing that up. Dr. Dara Kass, Columbia University Associate Professor of Emergency Medicine, thanks so much for joining us today.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.